Hormone imbalances in men are on the rise, and it's very likely possible that at your current age, your testosterone levels are much less than your grandfathers were at that same age. We are seeing a population level decline in testosterone across the board. And I know this because I'm in practice now for 10 years, and I run blood work on patients every single day. And I'm just seeing it go down and down, and the reference range is getting skewed lower and lower. So yeah, there's an epidemic of testosterone deficiency out there. What does it look like? So I have guys coming in, they are dealing with fatigue, low energy. They no longer have regular erections in the morning or morning wood. They're falling asleep after dinner. They're losing muscle mass. Hair distribution throughout the body is changing. They just don't have that oomph anymore. And this isn't just happening in my 50, 60, and 70-year-old patients. In fact, sometimes when I test guys in that age bracket, their numbers come back surprisingly good, much higher than some of my 20, 30, and 40-year-old patients, which is crazy. So this is a problem, and it's a multifactorial problem. So if any of those signs and symptoms ring true for you, you're gonna wanna keep watching, because this is a big thing that I do and help people with in practice. So once you find or have a few of those signs and symptoms, and there's lots of questionnaires you can look at online. A popular one I use is called the Adam questionnaire. And if you answer yes to too many of those, then right away you're gonna wanna get into your doctor or reach out to a professional like me and do a proper workup. So assessment is key, and catching it early is much better than waiting too long. And as guys, sometimes we're notorious for, we basically have to be dying to crawl into a doctor's office, but if something's up or something's off, early detection is much easier to deal with, okay? So you're gonna wanna do a full hormone panel, but there's also other systems that can impact testosterone, and we're gonna kind of explore that because we have this epidemic of deficiency and younger guys are dealing with it. How is that happening? So one of the big ones is chronic stress. If you're not sleeping 7 or more hours each night, if the stress is crushing you, whether it be a toxic relationship, a job you hate, lots of family stuff going on, that's going to impact your hormonal output, because if your body thinks you're running from a saber-toothed tiger and cortisol levels are high, that's going to suppress your body's ability to create testosterone. So that's a big system we need to look at. Thyroid dysfunction, low thyroid, low metabolism will also decrease the output of testosterone. There's a gland here, your thyroid, it's a little butterfly-shaped gland, and it communicates directly with the testicles. And if it's running low, your testosterone may not be far behind it. Vitamin D deficiency, we're dealing with an epidemic of that, and vitamin D is a prohormone, so that may be what's causing some of your low testosterone. It's not just a vitamin, it helps control the hormonal axis as well. Lost sleep, we already talked about. A lot of guys are over-consuming alcohol, too much marijuana, directly suppressing their output of testosterone. Nutrient deficiencies is another one. So if you don't get enough zinc in your system, you can't generate and hold on to your testosterone, so that's a big one. And then the gym, you need to make sure you're pushing your muscles. This stimulates the breakdown of muscle, which signals the release of testosterone so that muscle protein synthesis can kick in. This is critical. You need to be strength training 3 to 4 times a week. It will literally save you. And the more muscle you build, the more signal you have for testosterone, and around we go. So this is the way. So if you're dealing with a lot of this and you're gonna go seek medical advice, here's some things that you're gonna wanna look at. You're gonna wanna look into one of those questionnaires, maybe have a couple that you filled out so you can be like, hey, like on the Adam questionnaire, like I've answered yes to all of these. I also have all these symptoms. I've noticed less muscle mass, changes in body hair, changes in voice. I don't have morning wood several times a week. You're gonna wanna document some of this so that when you go to your doctor, you can tell them what's been going on. And then you're gonna wanna make sure that a proper assessment is done. And this is where it's good to have some notes so that when they write up the rec form, you can make sure you're getting this done properly. You don't want to just do a few things and miss some key ones. So at the very least, you would want hematology, check your iron levels and ferritin. That's always just a good baseline thing to do. Make sure the kidney and liver functions are on the list. You also want to then get testosterone, bioavailable, total testosterone, estradiol, sex hormone, binding globulin, thyroid, as well as free T3 and free T4. Another thing that can really mess up testosterone is high blood sugar or high insulin, so you want a fasting insulin as well. And then you want to make sure you get your vitamin D checked, like I was alluding to earlier. So all of this stuff needs to be looked at in conjunction with the signs and symptoms, and then an educated clinical decision can be made. And then from there, how low is low? Then we can talk about door number 1 and door number 2, where door number 1 would be lifestyle, would be cleaning up, whether it's, getting the alcohol out, sorting out the diet, fixing the blood sugar, making sure your sleep is dialed, getting the marijuana out if that's an issue. And then from there, it's like, okay, nutrients, supplements, herbs. Been having really good success with ashwagandha, KSM 6.6 strain, zinc, 25 to 30 milligrams a day, crucial for testosterone. Tongkat Ali, 500 milligrams a couple times a day, and Fedosia agrestis. So these are all natural, lifestyle-driven ways. That's door number 1. And then say you're 35, 40, you've done all that, you have a clean lifestyle, your testosterone's suboptimal, you're done having kids, you're not too worried about fertility anymore. That's where you could maybe look at the TRT route, but realize that's a long-term, once-a-week injection. And it's not just you take it for 2 or 3 months and stop. This is a long-term play. And it's not to say you can never get off it, but once you get on it and you start feeling good, it's much harder to get off it. So I always tell people, door number 1 with the lifestyle, nutrients, herbs, gym, get rid of the coping mechanisms, the smoking, the drinking, the marijuana, sort all that out, and usually that'll fix things. But should you want to go the TRT route, you now have to manage some potential side effects. And this is things like thick blood and higher blood viscosity, increased high blood pressure potentially, and then high cholesterol. So those are 3 well-known side effects that you simply have to keep an eye on for the duration and time you use TRT. So it's a big commitment. It's not to say people don't do that and manage it well, but just think about that before you run down that route. And usually with one drug often comes others, and people get wrapped up with whether it's testosterone and then some orals, and then before you know it, they're on 2-3 things, and then they're taking another thing to manage the side effects. And so it's just like, be careful, because that can be a slippery slope. It is an option, but it could be a slippery slope. So if you're dealing with these signs and symptoms, and you've maybe been to your doctor and they've simply dismissed you or said, oh, you're too young, or I'm not going to run your testosterone levels, like, you need a second opinion. It's okay to fire your doctor and get some help, because you need a proper assessment. I mean, that's owed to you. You easily deserve at least to start there. And so if you have doctors that sometimes don't even want to run this stuff, run away from them and find someone who will. Okay, you need that full workup I mentioned earlier. And then you need someone to help you interpret it, so you can get the lifestyle advice, the supplements, the diet. It's about finding the cause, okay? Because if you have low testosterone, but your sugars are out of whack, your cortisol's through the roof, you're not sleeping, and you're vitamin D deficient, you can't just plug a ton of testosterone into that system and expect it to work. You're probably going to over-convert some of that to estrogen. You're just simply not going to feel good. And if you do, it's going to be short-lived. You might buy yourself a few months, but then you're going to go back to feeling like crap again, because all those other broken parts of your metabolism have not been dealt with. So don't sell yourself short. If you get everything optimized, there's a high chance you won't even need to go the injectable route. And then even if you do, it's going to be at the minimum effective dose with way less side effects and way more sustainable, okay? So if you have questions on this, drop a comment below. If anyone in your life, friend or family, would benefit from this information, please share it with them. And as always, thank you for watching.